Hey, everybody. Welcome to the podcast of Harlan Cohen. And I'm so excited to share this conversation with Dr. Patrick Hickey. Dr. H, as his students call him, Patrick. That's what I call him. I've known Patrick for probably over 15 years. And he's such an interesting guy. Oh, you'll love this. He's been a nurse for over 40 years. So he started being a nurse before very few men were in this profession. And he has mentored tens of thousands of students. He also is an adventurer. He wrote a book called 7 Summits: A Nurse's Quest to Conquer Mountaineering in Life. He climbed 7 peaks on 7 different continents. He's someone who really has a deep appreciation of just living. I think that's also a big takeaway. Saying you go into nursing because nurses save lives. And he's someone who's very passionate about the profession and helping students to figure out how to navigate their professional nursing careers. So you're going to get so much out of this. I learned so much. I know you're going to really enjoy learning about Patrick, and there are so many takeaways. Instead of telling you any more, I'm going to let you listen. Enjoy this conversation with Dr. Patrick Hickey. Today, I am with Dr. H. Patrick Hickey, one of my favorite people. I've known him for, I don't know, has it been 15 years maybe?
Yeah, 15, 20 years, Harlan, kind of like an old married couple.
It's great. Patrick, in addition to being a nurse and mentoring tens of thousands of students, and our paths crossed at the University of South Carolina, where you were running, was the capstone program?
That's right. Yeah,
Capstone Scholars?
had a lot of different roles at the University of South Carolina. In addition to being nursing faculty, I was the principal of a living learning community called Capstone Scholars. There was the Honors College, and right under Honors were Capstone Scholars. But the difference were, we were just as smart as Honors, but we had a lot more fun. So it was a good, great cohort of kids. They spoiled me.
It was great. And you brought me in to speak. And then Dave, who is the assistant director, right? Dave.
Yeah, good memory. Good recall, Harlan.
Oh, he was good. You guys are great. Is Dave still there?
Yeah, still there. Yeah. Still plugging away, making a difference in the lives of students every day.
Yeah. What's his last name again? It's
David DeWheel.
Yes.
Yeah. Good recall. Good recall.
Yeah. You know what? I've always enjoyed talking to you, and Patrick also. We're going to get into the nursing piece today. I want people to understand nursing. I want people to understand how to become a nurse, why nursing is something that is such an important part of people's lives and your lives, and also just how to be able to navigate that career path. I want to do all of that, and I want people to understand how to stand out and how to make sure this is the right career for them. So we're going to do that. And Patrick has mentored so many people over the years and has such deep expertise. So I can't think of anybody who is better qualified to really walk people through that process. I want to get to that pretty quickly, but I want people just to understand a little bit about you and who you are. And if you can just give people your quick summary, and it's hard because you've done so many extraordinary things.
Yeah, the quick summary is a challenge, Harlan, but I'll do as best I can. As you can note from the stained glass behind me, Canadian by birth. Got my American citizenship years ago, so I'm a proud dual citizen. Nursing wasn't on my horizon when I was in high school. Really didn't know what I wanted to do. All my friends were going off to university, already knew their majors, where they wanted to go. So I took advantage of the guidance counselor in my high school. I don't know if they still have guidance counselors, but if you do have a guidance counselor in your high school, take advantage of them. They're all knowing. This lady's name was Mrs. Lamb, wonderful lady. And I approached her and said, Mrs. Lamb, I really don't know what I want to do with my life. And I didn't take an aptitude test or anything. She kind of knew me. She said, Patrick, I think you'd work great in a prison setting. I don't know where that came from. Always had a fear of being locked up. I told her that's not going to happen. Right. She sat there for a moment, looked at me again. She said, Patrick, I think you'd do great as a childcare worker. Again, oldest of 9 kids, too many kids around me. I didn't think that would work either. Then she came up with a third suggestion that literally blew my socks off. And she said, Patrick, I think you would make a great nurse. Now, this was 50 years ago when very few men, if any, were in the field of nursing. I didn't know if she perceived my feminine side. I don't know what she was saying when she recommended that I become a nurse. I wasn't happy about it. I do recall that I kind of stormed out of her office, and the last few words I heard her saying was, "At least give it a chance. There's a recruiter here next week. Go listen to him." So I snuck into that room full of girls, the only male, sat at the back. That recruiter said 3 words that changed my life: nurses save lives. Now, 50 years ago, we didn't have Grey's Anatomy. We had black and white TV. We were brought up to think that it was just doctors that save lives. I came home from that meeting with that recruiter, and I told my mom, the good Catholic woman that she was, "Mom, I think I'm going to be a nurse." She said, "That's as close to godliness as you can get." Now, when I told my dad that I was going to be a nurse, it was a different, a different reaction, much different than my mom's. He disowned me. He just couldn't fathom that his son was going to be a nurse, because 50 years ago, again, there were very few, if any, males going into nursing. In fact, in my nursing class in Canada, we were 5 males out of over 100 in the class. So we were in the minority. And as I've gone through teaching for the last 15, 20 years, we're still in the minority. So it is a challenge for men going into the nursing field. But again, I share that story, Harlan, because sometimes it's someone else that sees something in you that you don't see yourself. And everyone that comes into nursing comes in for a variety of different reasons. Some come into the field because it's a good job. The challenge with that, though, is there's a term in nursing, and I don't know if it's used in a lot of other professions, but it's called burnout. If you go into the profession for the wrong reason, you won't last very long, or it's going to be very, very challenging. So it is a challenge for students at a very young age to determine that nursing is, or healthcare is, what they want to do. My experiences have been a lot of students that have had either a medical problem themselves, a family medical problem, or have seen a medical practitioner treat themselves or a family member, usually are very passionate about coming into a field where they've already been introduced to it. But the good majority of students that come into the field have never had an introduction to healthcare at their young ages of 17, 18, and 19 years of age. So it does become very problematic with, what am I going to do in this field? Why have I chosen this field? What are the rewards for this field? I mean, monetarily, the money is much better nowadays as it was to when I went into it. Nowadays, graduating nurses are considered gold. They're highly sought after, and they have many, many, many more opportunities than what they did many, many years ago. But again, going back to what you originally said or queried, how do they choose that profession? At what point do they know they're going to make a nurse? And I think that is one of the biggest challenges in the nursing profession today. We have very passionate faculty that have all come into the field and are able to be great mentors for these students, as long as the students approach those faculty members to seek out that guidance. And therein lies the problem. A lot of students are very fearful of going to faculty.
Yeah. I think there's a lot of different angles to approach for students who decide to go into nursing. And I know that someone suggested it to you, and I know a lot of students I meet, I'll ask them what their major is, and they tell me it's nursing. And I'll ask them, how did you decide to go into nursing? And they'll say, my family said this would be a really good job. Nurses get jobs, and it's important for me to be able to get a job when I graduate. And
we look at it as a profession. Yes, it is a job, but it is a profession also. And we try to clarify that when we talk about the history of nursing. I mean, we're up there with physicians and lawyers and others. And if you look at the Gallup poll, nurses have been rated number 1 in the Gallup poll from when it started for honesty and ethics. So it's a very prestigious role that we're stepping into that a lot of students don't even know. But you're right. A lot of times it's a family member says this would be a good job. And you're right, Harlan. I mean, there's always going to be sick people. I mean, logistically, you have a job for life as a nurse because there always is going to be an opportunity.
And I think also, given what's going on with technology and AI, when it comes to jobs where you need to have a personal touch. There need to be people involved. There's relationships. It's relational. And I think that those jobs and career paths are going to be ones that are going to be a lot more predictable, a lot more reliable. And in terms of nursing as a profession, what are your thoughts? What have you seen?
Well, nursing as a profession is attracting more and more young people, and mostly for the right reasons. I think students really highly respect nurses. They've had a nurse at some point in their lives. Just think of yourself and your kids. You go to the doctor, you have a nurse at some point in life. So every one of us in our own way has had a connection with a nurse at some point in time. And that nurse usually is a great role model. And, when we're looking at role models and who we want to be when we grow up, here's someone that's already been in your life that you can look at. So it is a wonderful profession that continues to grow. We continue to have a need, though, in nursing. I don't know if nursing has done a good enough job at trying to attract more students to it because, as you know, we do have a great
Yeah.
shortage of nurses.
Yeah. When you are talking to students that are early in their academic careers, first year students, second year students, and they are planning to go into nursing, what are some of the questions you ask to help them to know this is a good path for them?
And that is a valid point, Harlan. As I mentioned earlier, maybe before we started recording, I do a lot of mentoring, and I meet weekly with students that have that same question. Am I on the right path? What do I need to go into this profession? Sure, I've got a great GPA, but I think nursing is much more than a GPA. How am I going to learn how to express my emotions? What emotions can I express? Can I cry? Can I hug people? Can I hold people? What am I going to do when someone dies? I mean, there's so much emotions. It's just like a roller coaster. And 18-year-olds aren't prepared for that. They don't know the questions to ask. So what I do in my methodology of teaching is I try to put my 40 plus years of nursing out there, and I teach by experience, and I try to share with my students what my experience have been, knowing that uniquely each and every student is going to have to develop their own reactions to scenarios. For example, when someone dies, that's one of the biggest fears students have. What they share with me, they say, Dr. Hickey, I don't know what's going to happen when I have to deal with a death. Is there going to be a class on how to deal with death and dying? I mean, we kind of touch on it. We don't have a class specifically on that topic, obviously, but we do bring up the subject and talk about it. So I relay my own experiences with death, dying, pain, and suffering, and how I, in my own way, connect with patients that are going through those situations or scenarios. And I put myself out there and I say, guys, here's what I do in these scenarios. Each and every one of you come from a different background. You all have different experiences. Some of you, God bless, may not have experienced death, pain, or suffering. Some of you have already had those tragedies in your life, and you kind of sort of know how to deal with it in your own way. But I think by role playing, by sharing our own lived experiences with students, we can help with the fear factor. And that's huge with nursing. I mean, I work with students all over the university setting, from English majors to geography majors, et cetera, et cetera. None of them have to worry about the things that nursing students have to worry about, which is the emotional aspect. I was brought up not to hold or hug people. We didn't say I love you and my family a whole bunch, but now I'm in a profession that kind of sort of, it's an unwritten, not an unwritten rule, but unwritten guidance that it's okay to hug people. It's okay to reach out and touch people. And to bridge that gap with students, I share with them quite often. I said, I always, in my patient interactions, reach out and I'll put my hand on their shoulder, or I'll sit on the side of the bed and I'll put my hand on their hand. That human touch is so integral to the nursing profession. That patient does not want to be in that bed. That patient would rather be home with their family. So to have a sterile environment where you've got nurses and doctors all buzzing around you and nobody touching you, so to speak, in a human way, is something that the students have to learn. And each of them in their own way gravitate towards that process once they've heard other people sharing what they have done.
Yeah. that's a whole layer that I don't know if a lot of students have really processed, what that means and being in those situations. When it comes to the different types of nursing, and let's just say, I'm not familiar with nursing. I don't really understand the profession.
Mm-hmm.
What are the different types of nursing, if you were to just, or of career paths that a nurse can choose?
Wow, it's limitless, Harlan. To begin with, to get into nursing, there's various programs. There's 2-year programs. There's diploma programs, which they rarely have anymore. It's almost like a 2.5-year program. There's 4-year programs. And then every student, once they come into the nursing program, have to decide which path they want to go down, which specialty they want to work in. If I had a dime for every student that said, I want to work in pediatrics, I'd be a millionaire right now. I mean, God bless, they all want to work with kids because it's fun working with kids. When I first started the nursing program at the University of South Carolina, one of my students was working in pediatric oncology. And I spoke to that student. I took her aside and I said, how can you work in pediatric oncology with these poor young kids that may not have their next birthday? She said, Dr. Hickey, just imagine how much love I can give them in the little time I have. So everybody in their own way has to deal with the scenario that they're walking into. But specialty wise, the sky's the limit, from pediatrics to OBGYN to orthopedics to the operating room to the emergency room to advanced nurse practitioners to nurse anesthesiologists. There is something for everybody. No matter what your interests are, you'll never go wrong. And the beauty of nursing is you can work in a specific specialty like pediatrics for a while. And if that burnout happens, which happens to a lot of us at some point in time, you can switch to OBGYN. You can switch to emergency. You can switch to oncology. There's so many specialty areas. So within all those specialty areas are opportunities to get national certification to prove to your patient that you are a patient advocate. For example, I used to work in a trauma room setting as an emergency room nurse. I sought my national certification. I was a certified emergency nurse. So on my name tag would have Patrick Hickey, RN, BSN, CEN. That proved to my patients that I went the extra mile to develop more confidence in my profession. And a lot of students, once they get into their specialty areas, will be able to prove that to their patients also by attaining national certification.
Yeah. Let's just go through some of yours because I have a long list of letters. So I'm just gonna mention each one, and I know what a lot of these are, but I think it's really helpful. So the first is RN.
Yeah, so so my RN I'm a diploma nurse, and there's not very many of us. A diploma nursing program is there's very few left in Canada and the United States. It was a program where we went to school like the regular nursing students do, a 2-year program. But the last 2 to 3 or even 4 months of our program was 40 hours a week working in a hospital setting. So when we graduated from the program, we already had the skill sets of a nurse. The students graduating today from my 4-year program will have book knowledge, but they won't have clinical skill sets. The average student nurse that graduates now from a nursing program, again, has started very few IVs, if any, have put in very few Foley catheters, if any. But every hospital knows that, and every hospital is prepared to put them through a 2-month, 3-month, 6-month orientation program to give them the clinical skill sets that they need to function as a nurse. So the original RN behind my name was for the diploma nursing program.
Okay. I want to go through your letters, but I want to just address something you just mentioned, which I think is so important, is you have a lot of students who spend a lot of time and energy and money pursuing a career without having a lot of hands-on experience.
Mm-hmm.
And this is a question I have for nurses all the time, for people who are pursuing nursing degrees. And I asked them, I said, how do you know this is what you want to do? Have you shadowed someone? Have you had those experiences? How important is it for someone who's committing to a nursing to a healthcare career, especially in nursing, to have shadowed someone, to have those experiences?
I think it's huge, Harlan. It's integral to success in the field. The challenge, though, is you mentioned shadowing. Very few students have an opportunity to shadow. I work predominantly with pre-med kids now. How do kids figure out they want to be doctors? Well, they should shadow just to see what a day in the life is. But unfortunately, here in America, it's very problematic because of HIPAA, confidentiality rules, and a lot of other barriers. So the average nursing student that comes into nursing has not stepped a foot into the medical field. They've seen it on TV. They've heard it from someone else. Maybe an aunt or someone is a nurse and they thought it would be a good profession. So in retirement now, I work for a company and I support a company called International Service Learning. We actually promote opportunities for students to travel abroad to an international country of their choice and get actual clinical hands-on care as a freshman, which is huge because I feel very strongly that at an early junction in your scholastic career, you should have a better clarification of what you want to do. You're not going to get that by just going to class and hearing lectures from faculty. You're only going to get it from an experiential opportunity where you have hands-on experience. And so it's sad, unfortunately, in America here, that we are challenged with students getting their foot in the door with an opportunity to shadow because everyone's just so busy right now.
How could that be? I mean, I know there's HIPAA laws, but like if you're a student who is in a college setting, I would think that actually getting into a hospital or participating in some capacity in some of the things that they're going to be doing, you know, for essentially their entire professional career, if that's what their specialty is, it's that hard to get access?
Well, no, it depends on the scenario, Harlan. I mean, here in Columbia, South Carolina, where I live, we actually do have a variety of hospitals, which they do have volunteer programs for student nurses. So we try to push them into those programs. We try to direct them into those programs. But unfortunately, push comes to shove. And as you know, working with students yourself, normally first year students aren't told to bring their cars to school. So now we have a transportation challenge or issue. Yes, there's Ubers or other ways to get there. Sometimes the opportunity may be late at night. Maybe it's not as safe as it could be. But yes, there are opportunities. And as much as we promote or push them or recommend to them for the students to do it, we can't force them. So unfortunately, a lot of students won't go through the opportunities that we provide for them. They may be busy. They may be busy socializing. They may be busy studying. They may not know or realize the value of doing what you said, taking advantage of a volunteering opportunity.
Yeah, that's fascinating to me because I just think it's so helpful. I mean, at a minimum, I would say to the students, talking to people who have been in nursing, and I suggest talking to someone who has been doing it for a year, 5 years,
Yep.
10 years, and 20 years. What
Well,
do you think of that?
That's a good point. Actually, the director of nursing at a local hospital years ago asked me to come over and be the keynote speaker because it was Nurses Week. And I used to teach a lot about the history of nursing and having pride in your profession. And I told her, I said, you don't need me to come over and speak to your staff about the professionalism of nursing. You need my 18-year-old nursing students who are wet behind the ears to come and shadow your veteran nurses and let your veteran nurses look at these students and say, you know, I had that passion at one point. It may have gone away a little bit. I need to get that passion back. So it's the beauty of students working with veteran nurses, as you indicate, is they'll learn a lot about the future profession that they're stepping into.
Yeah, I think it's interesting. It's, again, for the students who are listening, it's not recognizing, you know, when you talk to someone who has been doing something for so many years, those people really appreciate your curiosity.
Well, every one of us, Harlan, to a T, as nursing faculty, want students to come into our profession. We don't want to weed anybody out. We want them to come into our profession. We want to open doors of opportunity for them. We want to share with them our life experiences so they know better where they want to go and what they want to do. Every one of us, to a T, in nursing, I know for a fact, my colleagues, we all want students to succeed and do well. And I always make the case, I joke about it, but I always make the case with my nursing students. I always say, listen, I'm going to go the extra mile to help you, and I'll provide as much help as I can. And I'm doing it because I'm selfish. And my students always look at me and say, Dr. Hickey, you're not selfish. I said, no, I really am. I said, I want you to do well because I'm making the case that at some point in time, you're going to be caring for me, my wife, my family, or someone else that's a good friend of mine. So in that way, I'm kind of selfish. I want you to do well because I can kind of create that Kevin Bacon 6 or 7 degrees of separation between us.
Right. You don't want to. Right. You really can't be an unreasonable professor and mentor because you're going to look up and this person's going to be walking in your room at 2 a.m. They're going to be they're going to be the night nurse. They're going to be like, oh, Dr. H. Oh, finally, payback. Smart. I get why you do that.
Yeah.
Okay. So the RN. So I'm going to stick to this. I'm going to stick to getting through the different letters of after your name. So we got an RN. We addressed that. BSN. What's BSN?
Harlan, the BSN is a baccalaureate of science and nursing. That's a 4-year program. I went back to get my BSN when I was living in Corpus Christi, Texas. I had the wonderful opportunity to work as a nurse when I just started nursing on a medical surgical floor. Most of our nursing students today, they want excitement. They want to go straight to ICU. They want to go straight to the emergency room. But again, as I said earlier, all they have is book knowledge. They don't have a lot of clinical skill sets at that point in time on graduation. So what we veteran nurses always suggest is they get medical surgical experience where you earn your wings, so to speak, as a nurse. You learn how to start IVs, you learn how to give injections, you learn how to change dressings and how to titrate medicines, et cetera, et cetera. So when I moved from Canada and I did my first job as a nurse, I worked on a medical surgical floor. But I wanted to get into the emergency room, and the nurse manager at that time was actually a male. He said, Patrick, I want you to get a year of experience in medical surgical nursing. I didn't want to do it. I wanted to go straight to the ER like every student does. Yeah. But I listened to him. I did my year exactly to the day I came back. He said, I want you to get some critical care experience now. So I went to a coronary care unit. I worked for a year. Then I came back. He said, okay, now I'll take you into the emergency room. And when I started working in this, which was a level 1 trauma center, every hospital has a level according to the severity of patients that they take. A level 1 trauma center takes the worst of the worst, the shootings, the explosions, et cetera. To be a level 1 trauma center, you need to have an anesthesiologist, you need to have a trauma surgeon right there ready to do emergency surgery in the emergency room. So I worked in a level 1 trauma center in the emergency room as a charge nurse on the evening shift. Anything and everything that happened came in the door. But what was happening, Harlan, was I was seeing way too much death and dying, and I was starting to take it personally. Like, is there something I didn't learn in school that could have helped me in that scenario to help a patient to live? So I always remembered in nursing school, they always shared with us, try to attain the highest level of education as you can. And they made the case that more education equals saving more patient lives. So I went back to school and I worked on my BSN degree, which was my baccalaureate of science and nursing.
Okay. How many years did that take?
Normally it's a 4-year program if you start out, but because I already was a nurse, I think it was only a couple of years at that point.
Okay. And I know that nursing is not about getting paid, and that's a byproduct of saving lives is you're able to also get paid. But when you have these different credentials, does it increase your pay?
Well, and I had the same conversation with a student just yesterday that I was mentoring that went into nursing because it was a good job, and she didn't know much more about it. So we spent about an hour over coffee explaining more about her future profession, and I shared with her a thing in the hospital that most hospitals have, and it's called a clinical ladder. A clinical ladder, within a hospital environment allows a nurse to progressively climb within the hospital environment. And going to your question about credentials, depending upon your level of credentials is the level of pay that you will get. So if you come in with a BSN or a master's or a doctorate, yes, you will get paid more for those credentials or for those academic credentialing that you've earned.
But that is something that could be done over the course of time.
Yes. And the nice thing now, Harlan, about hospitals, they want to invest in their nurses. And most hospitals now will have a process where they will actually pay the nurse to go back to school. So typically my BSN, my 4-year prepared nursing students will start working in a local hospital. After about a year, they can apply for the in-house tuition so they can go back and work on their master's. To do that, they have to sign some paperwork to say they'll work a little bit longer, maybe an extra year at the facility, et cetera. But it's nice to know that hospitals see the value, again, of increasing the level of education of nurses. Again, going back to what I said earlier, more education saves more lives.
Right. And I know that originally when I said, talk to students, they'll say they'll go into nursing because their family said, you'll get a job. And I could tell even by saying it that way, your reaction was you're very controlled. This is not a job.
No. This is a job. I mean, you go to work, but it's a profession that you're stepping into. And we try to address one of the first courses I taught at the University of South Carolina was Introduction to Nursing. And I explained to students this wonderful, beautiful profession that they're stepping into, and all the fantastic people that have made a difference in the realm of healthcare. I mean, Florence Nightingale, the mother of nursing during the war, I mean, it was she that decided. She made a difference in soldiers' lives. She was taking care of all these poor soldiers that were wounded, and at that time, we didn't know much about sterility and she would, at the time, we would leave a dressing on a wound for days and days and days. Well, a wet dressing on a wound harbors bacteria, and people were dying from infections at the time. We didn't realize that. So it was Florence Nightingale that actually started changing dressings more often, started opening the curtains in the tents to allow more light and sunshine in. So there's been a lot of impact from nurses in healthcare over the years. And it just builds the profession of nursing that we've initiated from day one.
Yeah. It's interesting. There's so many different aspects to this. So BSN, and then you have an MS.
So again, when I moved from Corpus Christi, Texas to South Carolina, I actually wanted to go back to school and get more education. It was kind of frustrating at the time. I kept calling the College of Nursing because I wanted to continue in my nursing track. I already had an RN, I had a BSN. I wanted to get a master's in nursing, which is an MSN.
Okay.
But for some reason, nobody would return my phone calls. So a colleague and another friend of mine said, well, Patrick, you do a lot in the community. Why don't you pursue your master's in public health? So I called the School of Public Health at the University of South Carolina. They answered my call right away, said, come on in. Went in, spoke to them about it, and I started in the public health arena. So my MS is in public health.
Okay. So a little bit different. Has that helped you? Has that provided value?
It's been very invaluable. I love my nursing side, but I actually like my public health side much more. Public health is population medicine. It's more about preventative health care. In nursing, I'm already taking care of somebody that's in the healthcare environment. In public health, I'm trying to prevent them from going to a hospital. So I went down that road with my master's in public health. I went right from my master's in public health to my doctorate in public health. That's the DRPH that's behind my name.
Great.
And my research that I did during my master's and doctorate was I looked at the barriers that Hispanic people have when they try to access healthcare. Because my observation was in my hospital, I saw these poor Hispanic people walking around. We had no signage in Spanish. We had no literature in Spanish. We had no interpreters at the time. And because my wife and I had backpacked through Latin America for a year, I had passable Spanish. So I would go up to them as a gringo and say, hola, ¿qué tal? ¿Quiere ayuda? Do you need help? And I would help navigate them. But I saw it was an increasing challenge. So when I did my undergraduate research, or my graduate level research, I discovered there's laws in place that if you're a federally funded institution, you need to be providing services for people with limited English proficiency, which we're seeing quite a lot of today. So the master's in public health and the doctorate in public health, that actually gained me access to the College of Nursing, because after I got my doctorate in public health, I felt it was my time to give back, to teach. I wanted to give all this wisdom I've earned over the years back to my nursing students. But when I went to the College of Nursing, They told me I'd made a mistake. I'd had an advisement error, of which I'm sure you've heard of many times. And I said, what was that error? And they said, well, to teach in the College of Nursing, your master's or doctorate have to be in nursing. Mine were both in public health. So when I started teaching, I was a postdoc fellow in the College of Nursing, and I went back to school and I got my master's in nursing, which is the MSN. So in the morning, I'd be teaching students as Dr. Hickey. In the afternoon, I'd be sitting with them as Patrick in the classroom. So it's kind of confusing for that first couple of years. But
yeah,
a lot of my nursing colleagues felt, that nursing is a silo. Pure nursing is what you should be addressing as you go through school. I see great value in having other degree pathways. In my case, public health. I think that degree in public health, the master's and the doctorate, is what led me to develop an international healthcare course at the university, which has led me to lead literally thousands of students to go to developing countries to get hands-on healthcare experience, all because of my degrees in public health. And then the combination of the public health and nursing has qualified me to do quite a lot, actually, at this point in time.
So the public health was a result of someone not calling you back.
I know. Isn't that crazy? Isn't it crazy how we go down the pathways we go down? Nursing didn't call me back, so I went down the public health field for a few years. But it's all good. I mean, I'm glad it worked out the way it did.
Well, I think it's revealing, because a lot of students get really caught up in what am I going to do for the rest of my life, and that thinking is thinking that doesn't really get us to the rest of our life. It just gets us to freeze, because we have to live our lives and just go in a direction with an understanding that it will reveal itself if we can continue on that path that aligns with the things that are valuable, that provide meaning and mentors.
Well, Harlan, so much has changed over the years. I'm 70 now. In my day, it was that 110% work ethic. We worked at a job, we stayed at a job for 10, 15, 20 years. We were loyal to the company. Now what you see is in nursing, I see a lot of it, nursing actually, and other students are getting out into their various professions. They work for a year here, then they go for another year here. That used to be frowned upon when they looked at your resumes. But now what I hear my students saying that are working in the nursing field, when the HR person says to them, well, tell me about this 1 year at this hospital, 1 year at that hospital, I'm kind of concerned by that. That's a little bit of a red flag. Their comeback now is, well, I got a year of experience in this hospital. I felt it would help me to go to this next hospital to get a year of experience there. And I think the year of experience I got at that hospital is now going to help me with my experience here in your hospital. So what I tell students all the time is they really need a little bit more of my 110% work ethic. But then I need a little bit more of their quality of life, because what I see now, students are choosing pathways that afford them a quality of life that we never thought about. For example, as you asked earlier about the different pathways in nursing, a lot of times now they're looking at opportunities that give them a 9-to-5 work week, no evenings, no weekends, no call. And who wouldn't want that? All of us veterans that have been here for a while have done that. We've worked the night shifts. We've been on call. We've done all that. And we tend to want to make them walk through the same pathways that we went through, but they don't have to, because they do have more opportunities.
And it's a great takeaway of, I think, having a mix of talking to people who have been there and done it, who have a lifetime of experience, and then also talking to those people who are starting off, who are in different phases of their careers. I think that just as I put together this book and think about, how students can approach exploring careers, there really are different stories. And I think, your humility and the respect you have for, I think, new professionals is something that not everybody has. And
I like the fact that students are thinking more of quality of life. I mean, here in the United States or Canada, the world, we all want a long life. But after having been in healthcare, Harlan, for 45 years plus, I realize what's most important is quality of life. I mean, here in the United States, Canada, the world, we're putting in pacemakers, we're putting people on medications, we're increasing longevity of life. But what's most important is quality of life. And I think our younger generation are seeing that. They don't want to put in the 80-hour weeks. They don't want to. They put more value on having a family, and not that we didn't value having a family back in the day, but they're okay, I think, to maybe work for less money. Whereas on the night shift they get overtime or double time. They don't care about that. I want to control my life, because when a student nurse graduates and they go to work, someone is controlling their life. Someone is saying, you need to work 7 in the evening till 7 in the morning, Thursday, Friday, Saturday, and Sunday. Now, when you're 21, that kind of puts a damper on your social life. You want to get out there and meet people. Weekends are times when you do that. But someone's controlling your life, and you have no control over that unless you pick a path that affords you the opportunity to work a 5-day week, no evenings, no weekends. But when doing that, you may not be getting paid, the money you could be paid in a hospital setting, but so be it.
Right. So you have to explore that. What's the CNOR?
So I'm a certified nurse of the operating room. So that goes back to your question earlier about the different pathways that students can take. When you go into a pathway, whether it's emergency room, pediatrics, oncology, critical care, within that specialty in nursing, after you've worked in that specialty for at least 2 years, you can write a national exam to show that you have studied and prepared to be a better advocate for patients in that specialty area. So I wrote my CNOR exam, and now I'm emeritus through the Association of Perioperative Nurses, to show to my patients that I went the extra mile, so to speak. When I worked in emergency trauma, I was a CEN, certified emergency nurse. People that work in critical care will have CCRN, critical care registered nurse, behind their name. And every specialty, oncology, pediatrics, et cetera. So when you go to a hospital setting and you look at name tags and they have all that gobbledygook, a lot of it is just them showing that they've done a little bit more to be a better patient advocate. And that's what the buzzword is in healthcare, is being a patient advocate. We all want to create positive patient outcomes. And to create a positive patient outcome, again, more education, more training, more studying to learn more about what you're doing and how you can be a better advocate.
That's great. I appreciate that. And I think that for anyone who's looking at going down a particular career path is to actually investigate what those letters are. Just going through your different letters and understanding each one is attached to an experience that led you to a place that helped you to grow in so many different ways. I think there's so much power in that.
Well, Harlan, I can compare nursing to being a pilot. I'm a pilot. And when you get your pilot's license, what was told to me is it's a license to learn. So as soon as you get your pilot's license, you can fly anywhere, do anything you want to do, but it's a license to learn. I look at nursing the same way. Once you get your nursing license, it's a license to learn. You just keep on learning. You don't get stagnant. There's always new medications. There's always new treatments. There's always new modalities. Every hospital keeps nurses trained on an annual basis. There's mandatory modules they have to go through. So nursing doesn't stop. The education doesn't stop when you graduate from school. It's just starting. You get out of school and you go, oh my God, I thought I was done with the books. No. The education keeps on going.
That's exciting to hear. I'm gonna wrap things up soon, but I want to do a quick speed round of when you have a student who is, whether it's approaching graduation or earlier, maybe their first year, second year, third year, wherever it is, at what point do you start talking about careers? And how do you prepare a student to be positioned to be in the best place, to have the most options, to get a job that really excites them and interests them?
And that's a good point, Harlan. I had that conversation again yesterday with a student, and she asked, how can I better prepare myself for my future profession? So depending on the program you're in our program, it's a 4-year program. After a certain course in the 3rd year, the students are allowed to work in a hospital as a nurse tech or something of that capacity. A lot of students will do it. A good number won't do it. They'll just continue to do their studies. But if you work in a nurse tech and you're interested in working in ICU, I always say work as a nurse tech in the unit that you want to work in. The staff get to see you, they get to like you, they get to see your time management, your organization, your communication skills. Then when it comes time for being hired, You go to the nurse manager and you say, hey, you've seen me work here for the last year. You know my work ethic. I'd love to be a part of your staff. That's how you get buy-in to your future profession, by investing yourself and taking advantage of working on a unit before you actually get hired there.
So that's one of the approaches, is to become a nurse tech. And then if you don't pursue that for whatever reason,
Well,
how does someone...
if you don't pursue that, then building up your resume. I'm all about resumes. You know, when students start as freshmen, I say, guys, let's start that resume day number one. What's most important in healthcare is service. Let's see you put some service on your resume. Let's see you get involved in student organizations. Let's see you get leadership within those student organizations. Let's see you study abroad. That makes you stand out. So everything that you put on the resume makes a difference when you go for that job interview, because if you just have a GPA on the resume, that just means you're book smart. Healthcare units want people that can hit the ground running. If you didn't work as a nurse tech, but you worked as a server in a restaurant, if you worked in some other capacity while you're going to school, that tells me as a nurse manager that you can multitask. So if I have a student that comes to me and they're graduating and they've worked as a server for the last couple of years of school and they maintain good grades and they did well, I know that person's going to hit the ground running. I want that person. But if they come to me and on their resume it's just a GPA and they've done nothing else, I'm a little concerned. I shared with that student yesterday and that a lot of nurse managers, depending upon the scenario in the colleges, would rather hire someone from a 2-year college than a 4-year college, because in a 2-year college, a nursing program, those students may have a larger patient load when they're training in the hospital setting. In our BSN population, we're training those students to be, yes, good nurses, but also leaders. So they may not have the patient load that a 2-year nursing program will. So, for example, our 4-year BSN students at the 3rd year or 4th year may only have 2 or 3 patients when they're doing their clinicals. A 2-year nursing student in a community college, depending on the scenario, may have 5 or 6 patients. Well, if you're a manager and you're hiring, who do you want? Do you want someone that's already been tested and challenged with handling 5 or 6 or 7 patients, or do you want someone that's only handled 2 or 3? I mean, both scenarios are a little different. Again, the 4-year program, we're training them to be a leader. So normally within 1 or 2 or 3 years of being on a nursing unit, that BSN prepared nurse is now starting as an assistant nurse manager, then progressing to nurse manager, et cetera, et cetera. So a lot of different scenarios there as to how they can, why they're hired on more so than others. And some of it comes down to their clinical expertise.
I want to just clarify that, because it sounds to me that it's more beneficial to be in a 2-year program because you're getting more clinical
Yeah,
experience.
and that's a good point, Harlan. I always address to my 4-year students, why are you here? Why are you in a 4-year program when you can be in a 2-year program? A nurse is a nurse is a nurse. So on a unit working together, a 2-year nurse and a 4-year nurse, they do the same thing. The 4-year nurse, yes, is going to get paid a little bit more because of the extra years of schooling, a little bit more, not a whole lot, a little bit more. And yes, the 4-year nurse is probably going to be tapped to move up the clinical ladder because of their 4-year degree, but not necessarily. So it all depends on the individual. I'm not saying a 2-year degree is better. A 2-year degree gets you into the profession much faster. So the scenario I always use is if you've got a sister or a brother that starts in a 2-year program, you're in a 4-year program. By the time you graduate, your sister or brother that was in a 2-year program has already been out working for 2 years and has already paid off their loans, et cetera, et cetera. So everybody in their own way has to decide why they want to take a 2-year program versus a 4-year program.
Yeah. I think that if you're also if you do a 2-year program and then you're working in a clinical setting and you then have another 2 years, in theory, you could prove that you are a leader. Yep. And you can be mentored by the leaders in that particular unit, seeking out mentorship, and have that be something that could, be equally beneficial. Is that
well? There are bridge programs now. So the 2-year nurse once they start working, there are bridge programs to get their BSN. They actually make it easier for them because, as I said earlier, we want to promote higher education. And again, limiting students sometimes, Harlan, to the four-year program, as you know well from working with university students, it's the cost. Sometimes a two-year program at a community college is going to be much more financially feasible than going to a four-year university. So again, a whole host of reasons and rationales why the two-year versus a four-year is important. But each person individually, depending on their financial situation, their travel times, family support system, et cetera, there's a lot of parameters that come in place as why they choose a two-year versus a four-year. But again, if you do a two-year program, there are bridge programs now that once you come into the profession, we will help you to get your BSN program. A lot of it's online now. There'll be a little bit of clinical experience, but it's all very doable.
So someone who is finishing their two-year program or they're on the cusp of finishing their four-year program, what are some of the things that you suggest someone look for in a full-time job?
So a lot of challenges looking ahead. I always challenge my students to do the research. In healthcare, a lot of places will provide sign-on bonuses, which sound great. Sign on to this hospital for $5,000 or $10,000, and that's huge. Students are thinking I can pay off all my loans, or maybe some loans. But sometimes those are red flags when you see sign-on bonuses. So you really have to do your homework on that.
What does doing your homework mean?
Doing your homework, look at the leadership scenario or their situation. Why do they have a sign-on bonus for a particular unit? Do they have a lot of travelers in the hospital? A traveler is a nurse that is kind of a Band-Aid on a problem we have right now. They're wonderful, they're excellent people that have a wide variety of experiences, and they come and they work in our hospital side by side, but they're not committed to the hospital because they're only there for a short time. They're filling a void, and that void is a shortage of nurses. But doing your homework means looking at a hospital, going on tour, talking to staff members when you're on that tour, looking at the hospital, the reputation. Do they have, with everything being on the internet now, do they have a problem with infections? Do they have a problem with turnover of staff? So there's a lot of homework you can do in advance, but definitely going and putting your best foot forward and interviewing. Also asking if the hospital has reimbursement for higher education. Ideally, you want to go to a hospital that's going to reimburse you as you pursue your master's and your doctorate. Do they have a clinical ladder in place where you can step upwards within the hospital environment with your credentials, your national certification, and get paid more money? And then do they have childcare? That's huge. Very few hospitals have that opportunity, but I share with my students quite a lot. As future managers, you're going to have to get used to dealing with shortages of staff when your staff members call in sick. And a lot of times the staff members call in sick because they have a child at home that is sick. And I don't want to be sexist, but a lot of times it's the mom that goes home and helps with the child. Being a nurse, we're 90%, depending upon what you read, female. So as a manager, you're going to have people calling in sick every day, and push comes to shove, you have to double up assignments. When you double up assignments, the data shows us you're setting somebody up to create a patient error, and that means a mistake. So there's a lot of dominoes in place. When someone looks at a hospital setting, you don't want to go into a scenario that's going to set you up to fail. A lot of students actually, when they graduate, Harlan, will go to a hospital or a facility where their friends are. Because with the young lady that I met with yesterday, she was all of 21. I'm 70. I said, do you really want to go and work in a unit where it's all 70-year-old people? We don't listen to your music. We don't understand your language. Or do you want to be with some people of your own age with a smattering of older people who are veterans who can train you? So a lot of things that they need to look at.
Those are all great factors. When it comes to choosing nursing, and this is a question, I'm always curious about, because with healthcare, you could be a nurse, you could be a PA, you can be a doctor, there's all these different levels. And when it comes to someone choosing to be a nurse versus choosing another pathway, how does someone know if they should be a nurse or they should be, and I'm sure I'm missing some of the other healthcare options. How does someone determine that?
It's a challenge that we deal with every day, Harlan. It's one that I take to heart because I try to introduce to students all of the other different specialties. I mean, from occupational therapy to physical therapy to pharmacy to PA, as you mentioned, MD, and then even on the MD pathway, you have DOs, doctors of osteopathic medicine. Nursing, you have nurse practitioners. So there are so many other entities out there. The majority of kids that come to college either want to be a nurse or a doctor. They don't know about respiratory therapy. They don't know about physical therapy because they haven't heard about it. So I think when I did my medical mission trips, I tried to bring all these kids together that kind of sort of thought they knew what they wanted to do and expose them to a lot of other people and other professions within healthcare so they could better understand what's going on. I taught a course in the Honors College at the University of South Carolina, and it was just about the perioperative environment. In other words, the operating room, because a lot of kids wanted to work as surgeons, but they didn't know what the day was like in the day of a surgeon. So I would take them up to the operating room in the evening. I'd help them to learn how to scrub in and how to learn more about instruments and actually scrub in with doctors. So there are opportunities to learn about all the other professions, but I don't see it being taught very well at the university level.
Yeah. So you really have to be curious and you have to walk into that office. And you said something really important before we started recording, is that you strongly suggest that first year students start building relationships with their professors from really the earliest opportunity, right?
Harlan, I've had high school kids come to me asking me, Dr. Hickey, will you be my mentor for the next 4 years? Yeah, that's huge. If I could leave the audience with one pearl of wisdom, so to speak, I've got many, would be to encourage your students to connect with faculty, make a connection first semester freshman, and then meet with that person every semester. Check in with them about your resume, check in with them about letters of recommendation. One of the biggest mistakes students make, Harlan, and there's many, but one of the biggest ones is a lot of them are going on to grad school and they don't feel the need to develop a personal relationship with a faculty member who has to write them a letter for grad school. The typical student will go to a faculty member and say, Dr. So-and-so, I had you for anatomy 2 years ago. You probably don't know I'm pre-med. I'm going to be going to college to be a doc. Can you write me a letter of recommendation? Well, most faculty will say, sure, I'll do it. But their typical letter, which we never give the student, is going to be, yeah, Susie was great. She came to class. She got an A. She'll be a great doctor. Well, the committee that's reading that letter knows for a fact that faculty person does not know you from a hole in the wall. So students need to get out of their comfort zones, start early, meet with faculty, let them know their dreams, their aspirations, where they want to go, what they want to do. Let that faculty member open doors of opportunity. Then when it comes time for the letter for graduate school, that faculty person is going to write an unbelievable letter that the committee knows that this person knows who you are.
Yeah, it's relationships and being curious. And the very last thing, and I promise I'm gonna wrap this up, is the costs. It breaks my heart when students accumulate a tremendous amount of debt and then they graduate and they're getting paid enough or not even enough to be able to repay their loans. So when it comes to advising students and guiding students, what are your words of wisdom in terms of responsibly financing their education?
Yeah, cost is a huge challenge, Harlan. There's just not enough scholarships. I'm one of those crazy few faculty that have endowed scholarships. I always tell my students faculty equals not much money, but I see the value of funding scholarships. As you know, I wrote a book about my mountaineering experience, which we hadn't chatted about. I wrote a book that did very well. It's called Seven Summits, A Nurse's Quest to Conquer Mountaineering in Life. All of the money from that book, all of my motivational talk money has gone to support scholarships for nursing students, but there's not enough out there. I encourage all my students to apply for as many scholarships as they can. There are scholarships if you apply for them. It may only be 500 here, a couple thousand there, but every dollar makes a difference. It is a challenge. Students have to have really good support systems. I really praise parents for seeing the value of putting their kids through school. I do see the value of kids graduating early, which I've really seen as of lately. a lot of kids that are graduating within, not nursing necessarily, but even pre-med or pre-PA, graduating a semester early or even a year early. And a lot of them have said, I'm doing this because mom and dad are paying a lot of money and they're doing it to save. So, your trajectory in a 4-year program does not have to be 4 years. If you do spend money on sorority life, that can cost a lot more money also. I mean, there are other ways that you can cut down on the finance. Myself, I was very different and unique in that I didn't have books for my class. I would put PDF articles up intentionally so students wouldn't have to buy books, because they typically buy a book for $150, $200. End of the semester, as you know, they go to sell it back and they get what, $25 or $20.
Yeah. You are fascinating. This is such an insightful conversation. Even just as you were talking, I was thinking, first of all, you have so much knowledge and you're so generous with it. And then also for those students who are looking into nursing, investigating those 2-year programs and really understanding those different pathways, and also talking to someone like you. For someone who wants to talk to, of course, you, they can reach out to you. And I want people to learn more about you. I'll include the book because, having climbed the 7 summits, and, there's so much about Dr. H that you should want to learn and explore. How does a student, reach out to someone? Like, how do they find someone like you?
Well, I'd like to hope and think there's a lot of people like me, but unfortunately, I don't see that in my workaday world. Students know the network, as you know. They can find student faculty that are student friendly. There are some in every university. There's a rumor mill. Students will find them. I mean, I'm more than happy to put myself out there to help as many as possible. When I meet with a student, I review their resume. I actually tweak it and revise the resume. I provide volunteer opportunities for them. I give them names of contacts, other mentors. And I tell them all the time, have more than just me, have multiple mentors. And if you have multiple people, as you know, looking over your shoulder, then you're in a good place because you got a lot of people. But if you're doing it all on your own, it's going to be a challenge. Open yourself up to the opportunity to be mentored by other people. Get out of your comfort zone to go to a faculty member that will be a mentor for you and that will guide you through the next 2 years or 4 years. And I do like your recommendation, Harlan, about the 2-year programs. I think it's smart. If you want entry-level nursing, affordability is an issue. Go to a 2-year program, get your feet wet, and then take a bridge program and get into the 4-year program and continue to build, get your master's and move on up into nurse practitioner, where you actually have a lot more autonomy and a lot of respect in that role also.
Yeah. I mean, there's so many different ways to navigate that path. The last thing, I know that you are passionate about international service learning, and I just want to make sure that our listeners know what that is. And also, I know that you are going to be launching your own podcast, and I'm really excited about that. So, in conclusion, will you let people know about ISL and what that is and how you plan on being there for them?
Yeah, I appreciate that, Harlan. So 20 years ago, I developed a course at the University of South Carolina. I saw the value of taking students to underdeveloped country to get hands-on healthcare experience because, as I said earlier, we just didn't have the opportunity here. It is a humbling experience. I've gone so many times, and I'm humbled every time I go on these experiences. The people have nothing, but they give you everything that they've got. And my students, some of them are very arrogant. I always share with them, you're going to learn a lot from these people in the countries we're going to. And they look at me and they say, Dr. Hickey, we're in college. They probably never even finished grade school. I said, you'll see. We come back from the trip. I ask, how much have you learned? Did you learn anything? All the hands go up. They share the values, the family, the love, and it's just an amazing experience. So, it may not be financially feasible for everybody, but for student nurses or anyone starting in the healthcare field, if you need an experience that is going to help to confirm this is what I want to do, look for an international opportunity. You can go with friends. You can go with a program called International Service Learning, or you can look at other programs that are out there. The beauty of international service learning, though, Harlan, is it's not like a puppy mill, so to speak. I've heard some students come back from international experiences where they're prideful of seeing 1,000 patients in a week. I don't think they really learned a lot if you saw 1,000 patients in a week. Our model is one where we take our time, we do a head-to-toe examination, and the doctor gets the student nurse or the student PA or the pre-med student involved in the process of doing a physical exam, something that we don't see at all here in the United States. So there's great value in international healthcare, and I strongly encourage students to take advantage of those opportunities as they present them to them.
Yeah, well, I am so grateful that you can share this. How do people find you? How do they find
Well,
ISL opportunities?
our podcast that you alluded to is going to be called International Service Learning Experiential Medical Education. I'm looking to start it in November. I'm going to try and capture the passion that students have either before and after a international healthcare experience. I'm going to be talking to industry leaders in education, study abroad, healthcare, spirituality. Spirituality, we didn't talk about it much, Harlan, at all, but spirituality and healthcare go hand in hand when you're dealing with patients. There's a great unknown in healthcare with a patient laying in a hospital bed. What am I waiting for? What did that lab show? Was my x-rays okay? And I tell my students all the time, having a deep faith is very important as you move forward in this profession of nursing. It really helps you with your interactions with students.
Yeah.
I'm out there. I'm available. I mean, Dr. H at islonline.org is my email address. And if anyone wants to shoot an email and wants to meet separately on Zoom or something like that, I do that quite often. And I enjoy doing it. And I enjoy making a difference with students because I do it because I just don't think, as you said earlier, that there's enough mentors out there that want to put forth our profession. We all have busy days in our workaday worlds. We all have our families. And I'm very, very, very fortunate to have a very supportive wife that allows me this opportunity to do what I do with mentoring. And the way I look at it, again, I'm investing in them. At some point in life, they're going to take the time to invest in somebody else. And if we all did that, what a better place we would have.
I don't think there's a better way to end this conversation. Patrick, Dr. H, Patrick Hickey, really enjoy visiting with you, and thanks for being so generous. And thank you for taking the time to visit with me and to be able to share this with everyone. Really appreciate it.
Well, Harlan, I appreciate your mentorship. You've been a good colleague and a role model also of sorts. I love what you're doing with students in the university in a college setting. I love what you're doing, trying to cut down the fear factor, trying to promote students to take advantage of as many opportunities as possible. There need to be more people like you out there doing what you do also.
Yeah, you're very kind. I have a hard time taking compliments, so thank you. And I really appreciate it. I know everyone listening appreciates it too.